Hello, I'm Natasha Kavanagh with Dubai Life TV, and I'm here with Dr. Babith Mankidy, who's a pulmonologist in the American hospital. Dr. Mankidy.
Hi Natasha, pleased to be here.
And pleased to meet you too. Dr. Mankidy, can you tell me a bit about your speciality?
Our specialty is a combination of pulmonary and critical care. So we take care of patients with lung problems in the clinic, and we also take care of critically ill patients in the intensive care.
Okay, can you tell me what the most common lung condition is in the UAE that you've found?
There's evidence that respiratory disease are very common in the UAE. It's after cardiovascular disease, it's it's the most common non-fatal condition in the UAE, primarily attributed to dust, smoking, pollution, things like that. So the most common conditions we see in the clinic are chronic bronchitis. There is a fair bit of asthma, and of course infections, that you see anywhere else, influenza, and also a rising incidence of lung cancer.
What treatment is available for such a condition here in the American hospital?
Lung cancer is often silent in the initial stages, so usually these are caught on x-rays, done for other reasons. They see spots, and then they come to our clinic for evaluation of these. We do further investigations like CT scanning, PET scanning for evaluating what type of nodule this is. And then we have advanced diagnostic procedures like bronchoscopy, where we can put in a camera into the patient's lung, guide a biopsy into that particular area of interest, and essentially diagnose the type of cancer they have. Okay. And then from there on, our oncology colleagues will formulate a treatment for chemotherapy, radiation, and so on and so forth.
Have you any advice for the asthma patients living here in the hot and often humid climate of the UAE?
Well, asthma patients do very poorly with hot and humid climate, of course, especially during summer times. The air is very hot and humid. It's difficult for asthma patients to breathe as such. But then also the dust, often causes flare-up of their condition. Often the air conditioning ducts have colonization with mold and things like that, which exacerbate the condition. In general, asthmatics advise them to find a doctor and not self-treat, which is we find is a big problem here. So you have to get yourself a doctor that specializes in asthma or lungs, and have an action plan, because asthma in certain situations can get from being a gradual onset of symptoms into very rapid progression of symptoms, and it could be fatal.
Can you tell me a bit about the care you offer in the ICU?
Our ICU offers all kind of advanced diagnostic as well as therapeutic interventions here. We have most of these are a result of infections, pneumonia, influenza, and we also have a lot of post-operative, cardiac bypass patients, neurosurgical patients that come to the ICU.
Dr. Mankidy, could you tell me what's available for the treatment of conditions such as sleep apnea here at the American hospital?
Of course, sleep apnea is very common, again, because of risk factors, obesity, and so on and so forth. This is often undiagnosed, and we have sleep labs that can diagnose these conditions easily. There's also home sleep studies available that can be arranged, and that serves as a screening to see if you have sleep apnea. And then once you diagnose that, you can have a proper evaluation in the hospital sleep lab.
Ah, super. In the sleep lab here?
Yes.
Okay, great. Yeah, wonderful. Okay, well, Dr. Mankidy, it's been a pleasure to be in and talk to you today in the American hospital.
Thank you very much.
Thanks for seeing me.